You can use them to scare the children on Halloween. They're very deformed. And
Diane Gerhard knows her hands look painful, but she hopes she will inspire others just by describing them on CJOB. She has rheumatoid arthritis and can no longer open a round doorknob or a can of pop. She has had numerous surgery on her hands, a life-threatening condition with the tissue in her lungs, and been part of a clinical trial, all at the Health Science Center. She has been a patient here for more than 40 years.
they've really enabled me to live a pretty, it felt to me like a pretty good normal life. Raising my kids, and I taught science and math for 18 years.
Her mother had the same genetic condition. Gerhard says she feels lucky to have the care at HSC, as her mother had a much harder life.
I can remember her sitting just holding her hands in pain, and the treatment was hot wax dips. And so, she had a difficult adult life, and I did not.
She is hoping she will help others through their pain by sharing her story with CJB's Richard Kluche.
What's the one piece of advice you'd give to folks?
Keep your sense of humor.
The Gift of Hope Radiothon is raising awareness about all the work the Health Science Center does. Not only did they hear from Diane, but also from an anesthesiologist, a transplant patient, and a mother who had an at-risk pregnancy.
Because it is a broad amount of stories, and so we try to give, again, that feel. I think they realize that if it's not them, or it could be them, but if it's not, it's probably somebody they know who's had a similar experience.
CGOB is set up here in the mall at HSC. Now they want to connect their listeners to patients and doctors of HSC so they can better understand what happens in the hospital and raise money for the foundation. Alyssa McDonald for Live at 5.